In this presentation, I will be demonstrating how to initiate a primary line. I'll begin by running the primary line by gravity, assuming that I don't have a pump available, and then later on in the presentation, we'll presume that a pump becomes available, so I'll take the existing line and place it on the pump. So this is my patient, Mr. Tom Silver, and we'll assume that a new order has come across his heart, indicating that we need to start some primary fluids. Mr. Silver already has a saline lock that was placed during admission, so I don't have to worry about starting a new IV. However, I have to make sure that the saline lock is patent and without any complications. So that's where I'm going to begin. Before I go to the med room and get the IV fluids and the supplies that I need to start the primary line, I will first go in and visit the patient, let him know that I'm going to be starting some primary fluids and I need to take a look at his saline lock, and I'm going to go ahead and check it, make sure that it's doing okay. So I'll enter the patient's room, wash my hands, greet the patient. Hello, Mr. Silver. The doctor has ordered some IV fluids because it looks like you're getting a little bit dehydrated. So we're going to give you some extra fluids by way of your IV. And so I will just ask him for his name and date of birth to confirm, in fact, this is Tom Silver. And then I'm going to let him know that I'm going to take a look at his IV just to make sure that it is working well before I go ahead and get his fluids together. So I need to get some gloves on, and I have in my pocket, if I don't have this already in my pocket, then I need to go to the med room and grab a flush and some alcohol pads. So I'm going to go ahead and just prepare, get my flush out of the wrapper here, make sure that I have 0.9% sodium chloride, and then I'm going to take a look at the saline lock. I can put him up just a little bit here. And I'm going to make sure that I don't see any signs of complications. So I'm looking for redness, swelling. I can see if there's any temperature extremes here, exudate, and then I'm going to take a look at the dressing itself and make sure that it's dry and intact, there's no moisture under it, and that it's adhered on all sides. Now I have to make sure that it's patent. So for that, I need to flush it with some saline. And so here at the end cap is, I need to scrub that down first before I attach my saline syringe. Also, I have a slide clamp on the saline lock, and I have to make sure that that slide clamp is open, so I'm going to go ahead and just do that now. But I will then go ahead and do my 15-second scrub here of the hub of the saline lock. And so we have to scrub it with lots of friction. Make sure you include the threads as well as the top. I make sure that I don't put down the end here because I don't want it to be contaminated again. And if I do inadvertently lose hold of it, I would just have to scrub it, that's all, re-scrub it. All right, so now I'm going to get rid of the air that is in the saline flush. So each of these flushes will have a pretty good size air bubble, so you have to make sure you get that out. Pull down on your plunger first and then push up. You'll notice I'm touching the plunger length, and that's okay in this instance because the plunger is always behind the saline. We don't have to worry about contamination in this case. So pull down, push up, get rid of the air, and then I'm going to go ahead and attach the saline flush to the end of the lock by pushing and twisting, okay? And then I'm going to aspirate. I'm looking for a blood return to verify that the angiocatheter is in the vessel. And if I see a blood return, then I'm going to go ahead and gently flush with about 2 to 3 milliliters of normal saline. That's what's required of a peripheral catheter. If I don't see a blood return, make sure that you double check your slide clamp on the saline lock. Be certain that you've remembered to open it. But if you don't see a blood return, it does not necessarily mean that you have a bad IV. Go ahead and proceed with your flush more cautiously and look for signs and symptoms of infiltration. And of course, we would never push against resistance. Okay, so let's assume that I got a nice flash of blood here to assure me that this is in the vessel. And then I'm going to go ahead and flush with 2 to 3 mils of normal saline, and I am going to do a positive pressure flush, which implies that as I'm flushing at the end of the flush, I am going to slide the slide clamp closed. Positive pressure flush in that that is going to prevent any blood from refluxing back into the angiocatheter. So that's how you want to do your flushes of your saline lock. So everything looks good here. I'm going to take my flush into the sharps container, and I'll remove my gloves. I'm going to put Mr. Silver back down in a position of safety here. Let him know that everything looks good. So I am going to go to the medication room, and I'm going to go get my IV fluids and the supplies I need, and I will be right back. So now in the med room, I would go ahead and pull up the patient's chart, and I need to get the IV fluid and all the supplies that I need. So pulling up the chart, I'm going to take a quick look at the order again and be certain of what it is that I need. And I need D5 half normal saline, so I will go into my storage here, and I will grab the IV fluid that I need, and I will check it up against the EMAR, satisfying check 1. And in addition, I'm looking at the expiration. I'm looking at the bag for color clarity. I want to make sure there's no leakage, anything like that. And then I need to think about what supplies I need. So I need some tubing. I'm going to grab tubing. I'm going to grab a tubing label. I need some tape for the labeling of the bag. Okay, and as I said, I'm going to go ahead and run this by gravity because I don't have a pump available to me at this point in time, so I need to think about calculations here. And remember, I have to use the flow rate calculation to convert my rate from milliliters per hour, that's what is in the doctor's order, to drops per minute. Because when I'm working without a pump, I need to be able to count drops per minute. So at this point in time, I would take out my notebook and I would use the flow rate calculation to go ahead and determine drops per minute. And in this case, I have 75 milliliters per hour from my order. And when I calculate drops per minute, I get 12.5 drops per minute. So we could say 12 to 13 drops per minute. And if we want to do a 15-second count, we divide by 4, and that gives us about 3 drops in 15 seconds. So I'll manage the 15-second count, and then once I have that where it needs to be, then I can do a full minute count to check for accuracy. Okay, and so with all of that, now I'm going to go ahead and close the patient's chart and take my supplies back into the patient's room. So I'm back in the patient's room. Wash my hands on the way in. Hello, Mr. Silver. I'm back with your IV fluids. I'm going to go ahead and pull up his chart. Can you please state your name and date of birth for me? And he tells me his name and his date of birth. I compare it to what I have displayed on the chart and the wristband. And then I ask him to confirm allergies, and he tells me that he is allergic to bee stings, and so that's not going to be a problem for us today. So then with that, I'm going to go ahead and do check number 2. So I'm going to bring my IV bag up to the computer screen here, and I am going to very carefully check that I have selected the right fluid. D5 half normal saline, 1,000 milliliter bag. My rate is 75 milliliters per hour. To begin now, IV on Mr. Tom Silver. Okay, I want to think right documentation will occur when I scan it, and then right reason, does this make sense for my patient? And yes, it does. So with that then, I'm going to go ahead and get ready to prepare my infusion. So I'll begin with the bag, and I don't need to have gloves on. If you'd like to put gloves on, you can, but they are not mandatory at this point in time. Just make sure that your hands are washed. Gloves are optional. You can choose whether or not you want to wear them. So I did check too, and I just need a little bit of labeling on my bag. I need to label it with date, time, and initials because this bag will expire 24 hours after it's been spiked. So to be certain that I know when the tubing or when the bag was initiated, I have to make sure that I have it labeled. So with that, I'm just going to take a piece of tape. I want to make sure that I don't put this in over any critical information, so I want to be sure that I keep it away from the label and the expiration date. And I'm just going to put today's date and the time and my initials. So I know that tomorrow at this time, if this bag is still hanging, it will need to be changed. Okay? And then another note too, of course, we don't ever want to use a felt tip marker with any labeling of the bag because the ink can go through the bag and into the solution. Okay, so my bag is ready, and now I'm going to go ahead and take my tubing out. When you pull out your tubing, you want to be sure that you're securing both ends, that neither end touches the floor. We have the spike at one end, and we have the end of the tubing at the other end. They are both capped. They both must remain sterile. If they inadvertently become contaminated, this tubing is thrown away and we go get a whole new tubing. We have the roller clamp in the middle. The roller clamp will come in the open position. We're going to slide the roller clamp up the tubing toward the spiked end. We want it to be on the middle to the upper half of the tubing, so we want to slide it up, and once we slide it into position, we have to close it, and that's important. So we'll just roll the roller clamp down to clamp the tubing. Okay? All right, so now I'm ready to insert the spike in the bag. So I'm going to take this little blue tab off the bag and take the cap off the spike, and being very, very careful not to contaminate, I will push the spike, and you kind of have to use a little bit of a twisting motion into the bag. Okay, and there's a little ridge there, so you'll know kind of where to stop. All right. Now, once the bag is spiked, at this point in time, we hang it from our pole. Okay, and the next step is to prime the tubing. So with priming the tubing, we begin by filling the drip chamber. To fill the drip chamber, we squeeze it. We want it to be 1/3 to half full. So we're going to squeeze the drip chamber once or twice to get it to where we need it to be. And then the next step is to slowly open the roller clamp and allow the fluid to travel down the length of the tubing so that we're pushing out the air and filling the tubing with fluid. With IV therapy, of course, this is a critical element. So I'm going to bring my garbage can a little closer because I want to prime over a garbage can or a sink. And then I'm going to open my roller clamp And I want to let the fluid travel slowly down the length of the tubing, because the faster it goes, the more turbulence, the more air bubbles I'll be left with that I'll have to manage. So if we go nice and slow, we could pretty much prime it with very few bubbles. Now, the other thing you want to pay attention to is these little Y sites, injection sites, Y sites, those are synonymous terms. They like to trap air. So as the fluid is coming through the Y site, it's helpful to turn it upside down so that air doesn't get caught there. And sometimes you even have to give it a little tap to make sure that air is not settling in that Y site. So as the fluid travels through the Y site, turn the Y site upside down and tap the fluid through. So just kind of keep the fluid going. Watch it as it travels down. You'll notice I didn't take my cap off, because you can actually prime with the cap on. I would actually recommend it. That we don't have to worry about contaminating the end. The air and the fluid will escape around the cap, so just leave it on until the very last minute when you're ready to attach it. I'm coming up to the second Y site, so I have it upside down, tapping the fluid through and taking it all the way through to the end. Okay? And I'll probably lose a couple of drops off the end, and that's no big deal. So now that I've primed my tubing, I'm going to go ahead and check for air. So I start up at the drip chamber, and I just want to make sure that I have it primed thoroughly, that there's no pockets of air, no air bubbles lining up in here, anything like that. And so, with primary fluid, so there's a couple different rules that relate to air bubbles in the tubing. With primary fluid, because we have this big liter bag here, and this will run at 75 milliliters per hour, we can say that fluid loss will not affect the dose of this IV fluid. So if we lose some extra fluid off the end of the tubing, it is not going to affect the 75 milliliter per hour rate of this solution. So with primary fluids, the rule of thumb is if you find air in the line, so I'll do an inspection, and if I see, oh, I have some air bubbles here, I am just going to reopen my clamp and just run them out. Okay? In the interest of time, I'm just going to continue priming until all the air is gone. Okay? Now, if this were a medication, so if this were an antibiotic, or if this were the patient's insulin drip, or morphine drip, or what have you, I certainly, if I saw air in the line, I certainly could not just continue priming and lose all of that medication into the garbage can. That would definitely affect the patient negatively. It would affect the patient's dose, and we would be losing a lot of very expensive medications. So when we have a situation where this is a medication and we're priming the line in that regard, we still have to get rid of the air, but we don't want to just continue priming. We want to move the air to the end of the tubing before we release it. And how do we do that? In the nursing lab, we have developed this technique, or we've named the technique the guitar string method. So if I notice that there's an air bubble in the line, what I'm going to do is remember that air rises, and I want it to go in the direction of the end of the tubing so that I can collect the air here, open the roller clamp, release the air. I will likely lose a couple of drops of fluid, but certainly not a whole line worth. Okay, so how do I move the air? I'm going to turn the tubing with the end up, and in segments of about maybe a foot or so at a time, and then I'm going to strum the tubing like a guitar string, and you will notice that your air bubbles are going to travel down the length of the tubing toward the tubing's end. Now, when you get to your Y site, again, as I said, the Y sites, they really like to trap air, so you may have to tap it through the Y site, just like you tapped your syringes. Get it through and then keep strumming it to the very end. Now I've collected all the air to the end. I can get rid of it. It's still in there, but it's down here now. And I will just open my roller clamp, and out comes the air, and I lose 3 or 4 drops of fluid, but certainly not anything that will have a huge impact. All right, so now at this point, I'm primed. I checked for air. Everything looks good. And so the next thing that I need to do is I need to label the tubing. If I don't label the tubing, then the nurse who follows me, I've given that nurse an extra job because they will have to change it assuming that it is expired. So labeling the tubing is very important. So date, time, and my initials right underneath the drip chamber, like so. So we'll create like a little flag here. Okay. So now that my bag is ready, I'm going to go ahead and do my third and final check. So I'm going to check it up against the EMAR, check number 3, and then I'm going to go ahead and press administer, and I already checked identifiers and allergies. I'm going to scan in the wristband. Okay, and then I am going to scan in my fluids. All right. So my third check, my scanning is complete. All of my checks and balances have been satisfied, so I'm ready to go ahead and attach the infusion to the patient. So I'm going to rewash my hands and get some gloves on. So now that I'm working down by the saline lock, I need to have some gloves on. And I don't have to flush the line again because I just did that, but I do have to scrub the hub. So I'll do a 15-second scrub of the hub, and then I'm going to attach the IV infusion. Okay. A lot of good friction there. And then I'm going to go ahead and attach my line, being very careful not to contaminate the end. Again, we have a push motion, and then there's a little piece at the end of the tubing that we're going to twist into place to make sure that we have a nice secure connection. Okay, open up my slide clamp, and now I'm going to get out my calculation. Remember, I have 13 drops a minute, 3 in 15 seconds. So this is where I'm going to go ahead and open up my roller clamp, and I am going to start counting drops. So that is 3 drops in 15 seconds, and now I will hold for a full minute count. Between 12 and 13 would be acceptable. Okay? So at this point then, the IV is infusing, the primary line is infusing, and I would then go ahead, put my patient in a position of comfort and safety, make sure that there is nothing further that he needs. I will be checking in on him frequently. I have to make sure I put eyes on this infusion and his site every hour. I could come in more frequently, but I need to look at it at least once an hour to make sure that everything is running without any problems. So now a pump has become available, so I'm going to take Mr. Silver's IV infusion that's been running by Gravity, and I'm going to go ahead and put it on my pump. So just to be safe, I'm going to, I'll begin, let me wash my hands. I'm going to put on some gloves because I'm just going to clamp his clamps here while I'm transitioning from Gravity to pump, just for extra safety. So let me clamp his saline lock. I might have to move some of the clamps around in order to put the tubing on the pump. So I'm going to clamp this clamp down here, and then I'm going to go ahead and I have to move this slide clamp just a little bit. So I'm going to clamp, excuse me, I have to move the roller clamp. So I'm going to slide the slide clamp closed and just kind of move this down. I had it up a little bit high, which is ideal for Gravity, but may get in the way on the pump. So to move your clamps around, just to engage one while you're moving the other so that nothing drips. And in addition, I've also clamped the saline lock, so I have lots of backup here. All right, so this is the Sigma Smart Pump, and I'm going to turn it on. It'll ask me if I have a new patient that I want to input. I guess it went right past that screen, but oftentimes it does that. The Smart Pump, because it's loaded with a drug library, has to know your patient care area so that it gives you the appropriate library. So I'm telling it that I am in the adult area, Med-Surg, and then OK on the pump is enter, so it's highlighted already. I press OK, and then it's going to take me to this screen and ask me what it is that I want to infuse, and I want to infuse primary IV fluids. The Smart Pump knows that as IV, so it's like texting on an old phone. So we're going to just put in I and then V, and then it gives me all of the options here. And I have the IV maintenance fluids without potassium, so that's what I have here. And then this screen pops up where I program in rate. So remember now, rate milliliters per hour. This is the language of the pump, so we no longer have to be concerned with drops per minute because that pertains to Gravity. So milliliters per hour, remember the order is 75 milliliters per hour. So I will go ahead and put in 75, press OK to enter that. VTBI, volume to be infused. So that's what's remaining in the bag. Because this has been infusing by Gravity, I would have to estimate that. When this is a brand new bag, what I want to do is put in, it's a 1,000 milliliter bag, but I want to program it a little bit short of that because I want to change the bag when there's still a little bit of fluid at the bottom. So it's pretty common to go ahead and just put in 950 here so that the pump will alarm before the bag is completely empty because we don't want any air to be drawn into the line. So 950 and then enter it. Now I'm going to go ahead and put this tubing on the pump here. So in order to open the door, I use the slide clamp, okay? And so I'm going to push the slide clamp in, and then I'm going to run the tubing along the track here, and this Smart Pump will tell you if it's loaded properly by giving you check marks and prompting you to close the door. And so I close the door. Now I need to release the slide clamp at the top. I need to open the roller clamp wide open, and I need to open the clamp down on the saline lock. And then I'm going to go ahead and press run, and it tells me that the primary is infusing at 75 milliliters per hour. Before I run out the door, I want to be sure that I see drops dripping in the drip chamber, that everything is infusing without a problem. And so I'll stay to watch the first couple of drops, and it looks like everything is running just fine. So at this point, again, I make sure that my patient is secure, comfortable, that he doesn't have any further needs, and I can go ahead and exit the room and be sure to make my hourly rounds checking on his IV infusion and his IV site.